PCOS, polycystic ovary syndrome. And no, it is not just about cysts. If you are an African woman struggling with stubborn weight gain, irregular periods, acne, excessive facial hair, difficulty getting pregnant, or constant cravings, this video is for you. Let's go straight to the point. PCOS is a hormonal disorder, but the real problem behind most PCOS symptoms is insulin resistance. Not laziness, not lack of discipline, not spiritual attack. Insulin resistance. What is insulin resistance? When you eat carbohydrates, your body breaks them down into glucose. Glucose enters your bloodstream. Your pancreas releases insulin to move that glucose into your cells. But with insulin resistance, your cells stop responding properly. So your body produces more insulin. And high insulin levels trigger the ovaries to produce excess androgens. Those are male hormones. That is why you may see irregular periods, missed ovulation, facial hair, acne, hair thinning, belly fat. It is a hormonal chain reaction. Why many Nigerian and African women struggle more? Let's be honest about our food culture. Morning, tea and white bread. Afternoon, white rice. Evening, large portion of swallow. Snacks, biscuits, sugary drinks, fried snacks. These are high glycemic carbohydrates. They spike blood sugar, and constant blood sugar spikes worsen insulin resistance. PCOS is deeply connected to what we eat daily. PCOS is not just a fertility problem. Many women only pay attention when they want to get pregnant, but PCOS affects metabolism, mental health, energy levels, skin, hair, confidence, and long-term untreated insulin resistance can increase risk of type 2 diabetes, high blood pressure, fatty liver, heart disease. So this is not small. Signs you may have PCOS. 1. Irregular or absent periods. 2. Weight gain, especially around the abdomen. 3. Persistent acne. 4. Facial or chest hair. 5. Dark patches around the neck or armpits. 6. Difficulty losing weight. 7. Cravings for sugar or carbs. If you have several of these, you need proper medical diagnosis, not self-diagnosis. Now let's talk solutions. PCOS cannot always be cured, but it can be managed very effectively. The goal is simple: reduce insulin resistance, reduce inflammation, balance hormones naturally. Step 1, fix your breakfast. Stop starting your day with sugar and refined carbs. Instead of tea and white bread, try oats with chia seeds, eggs with vegetables, Greek yogurt with nuts, moi moi with vegetables. Protein in the morning reduces cravings later. It stabilizes blood sugar for hours. Step 2, control your swallow portions. Swallow is not the enemy. Portion size is the problem. Instead of very large portions daily, use moderate portions. Choose higher fiber options like plantain flour swallow, oat swallow. Fiber slows sugar release into the bloodstream. Pair your swallow with okra soup, vegetable soup, bitter leaf, fish or lean protein, not only starch. Step 3, reduce sugary drinks. Soft drinks, packaged juices, sweetened yogurt. They spike insulin rapidly. Replace with water, Zobo without sugar, lemon water, unsweetened tea. Small changes reduce insulin burden daily. Step 4, add anti-inflammatory foods. PCOS is also an inflammatory condition. Add more ginger, turmeric, leafy greens, fish, flax seeds, almonds. These support hormone balance naturally. Step 5, strength training, not just cardio. Building muscle improves insulin sensitivity. You do not need gym membership. Bodyweight exercises at home are enough. Squats, wall push-ups, glute bridges, light dumbbells. Muscle helps your body use glucose better. Step 6. Sleep. Poor sleep increases cortisol. High cortisol worsens insulin resistance. Aim for 7 to 8 hours. Reduce phone use at night. Sleep is hormonal medicine. What about weight loss? Many women with PCOS blame themselves, but it is not just about calories. It is about hormones. When insulin levels are controlled, fat burning becomes easier, cravings reduce, energy improves, periods may regulate. You are not broken. Your hormones need balance. Medical support. Some doctors may prescribe metformin, hormonal contraceptives, ovulation stimulators if trying to conceive. Always work with a qualified medical professional. Lifestyle and medical support can work together. Final truth, PCOS is common, very common, especially in African women, but it is manageable. You do not need extreme dieting. You do not need starvation. You do not need to punish yourself. You need stable blood sugar, balanced meals, protein, fiber, sleep, movement, consistency over perfection. If you found this helpful, subscribe, because we are going to talk more about PCOS-friendly meals.